Hi everyone, welcome to our April newsletter. I'm Dr. Jolie Silva here at New York Behavioral Health. I wanted to spend some time talking about Autism Awareness Day, which is on April 2nd. And the Autism Awareness color is a blue, so you might want to represent your support for autism awareness by wearing blue. You might notice that some schools and children are wearing blue that day. It's kind of like a brighter blue. You might also notice that there is an emblem for Autism Speaks that is a puzzle piece. So that's another representation of autism awareness. And it over the years, it seems as though the question about what autism is becomes less and less, although there is so much more for us to learn about it. For those of you that aren't as aware, there are two really hallmark features of people who are on the autism spectrum. And the first is a decreased ability for social communication and social interaction. So not picking up, not having that innate ability to pick up on social cues of nonverbal communication. And sometimes with people that have more severe autism, their language is impaired. So they have a hard time communicating or can't communicate at all via spoken language. The other feature of autism spectrum disorder is a very small area of interest and focus, or repetitive behaviors and actions. So it manifests as a specific interest in just one area and almost no interest in other areas, or wanting to engage in the same behavior over and over and over, like sensory stimulation, or doing things where they receive some kind of stimulation because other areas of life do not provide that stimulation. So, and there is a spectrum, right? We call it ASD, Autism Spectrum Disorder, because it can range from mild to severe. On the milder end, people can function independently, can be high functioning, but do have deficits in certain kinds of communication and have restricted range of interests. And then on the more severe end, you might find people who can't communicate via verbal language and have a hard time with social interaction and might need support as they get older and not be able to live independently. Autism can be diagnosed at a very early age. So if you have any questions about if your child is exhibiting any of these symptoms, going to a professional is the first place to start. You might want to ask your pediatrician, you might want to ask your mental health provider, and then you might want to go for a full evaluation to assess for these symptoms. If you have any questions about autism spectrum disorder or any other mental illness, please give us our website a click, which is newyorkbehavioralhealth.com. We have a link on there for Find a Therapist. So even if you wanted a consultation on any of this stuff, we have plenty of therapists and experts available in this area. So everybody have a great April. Please remember to wear your blue on April 2nd, and I will see you next month. Bye-bye.